Good, happy Friday morning, December 11, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin. First up, we're going to begin with your COVID-19 updates. New Hampshire COVID information, new updates and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 28,273 number of people in New Hampshire have tested positive for COVID-19. 15,577,813 number of people in the United States have tested positive. 584 number of deaths from COVID-19 in New Hampshire. 852 number of people who have been hospitalized with COVID-19 in New Hampshire. And 292,034 number of deaths from COVID-19 in the United States. Now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Manchester, 838. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 4879. And let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And the red, deaths. And let's take a look at this chart here, current cases. In the purple, total current COVID-19 cases, and in the orange, current hospitalization. And let's take a look at this chart here, total cases. Purple, total positive COVID-19 cases, orange, total hospitalization, red deaths, and blue recovered. And now let's take a look at this chart here, positive PCR test rate and daily PCR test. Let's take a look at this chart here, age group cases, female and male of cases, and risk information. Let's take a look at this chart here, infections, hospitalizations, and deaths. Let's take a look at this chart here, deaths. Percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. 14 new COVID-19 deaths. 14 New Hampshire long-term care facility outbreaks announced. There have been more than 28,000 known coronavirus cases in New Hampshire, officials say. Let's take a listen to that video from WMUR News 9, Gene Mackin.
Most legacy backup solutions are outdated. An hour of downtime could cost you as much as a new car. Veeam is a simple, flexible.
State health officials say there are more than 6,300 active cases of COVID-19 detected in the state today, an increase of 2,000 cases in 1 week. In that same week, 40 people died from the virus, raising the death toll to 584, with 248 in the hospital and the test positivity rate on the rise, The governor delivered a stern message.
You don't wear a mask and social distance just for yourself. You do it for those you're surrounding yourself with. And for those who are out there doing just the opposite, just to make some sort of bizarre political point, it's horribly irresponsible. It really is, and it has horrible consequences.
One of the high-profile outbreaks is at the Veterans Home in Tilton, which has now recorded 27 deaths. 87 residents and 81 staff members have tested positive in the past month. The VA has sent in 17 medical personnel, including members of the National Infection Control Team. The state epidemiologist warns that community spread is on the rise and everyone needs to take action.
Without a high level of compliance for mask use, social distancing, avoiding social gatherings, avoiding travel, especially around the holidays, the rates of infection and spread within our communities will likely increase.
14 new outbreaks were announced just today at long-term care facilities and institutions in New Hampshire, including the men's state prison.
Okay, and there you go on that video and that report. Late New Hampshire House Speaker Dick Hinch died of COVID-19, autopsy shows. Hinch had faced questions about COVID-19 cases that arose from a meeting last month in November. Let's take a listen to that video from WMUR News 9, Siobhan Lopez.
Well, winter's here. So what? Mahindra, the official tractor of tough.
New Hampshire House Speaker Dick Hinch of Merrimack will be remembered for how he lived.
A tireless leader, an incredible advocate for his community, and he will without a doubt be very, very sorely missed.
But right now, how he died is serving as a cautionary tale. The 71-year-old Republican lawmaker died unexpectedly Wednesday of COVID-19.
Really just a stark reminder, unfortunately, that this virus really doesn't care if you're in a long-term care facility or if you're an elected official.
State health officials are conducting contact tracing. The speaker's death comes after in-person events with other lawmakers. House and Senate Democratic leadership are requesting testing availability for legislators and staff who were potentially exposed.
Any of the events, whether it was the caucus or the organization day or individual meetings or whatever it is, anyone that may have come in contact with anyone known to have COVID or they have any concerns, I think folks should definitely go get tested.
Officials are not releasing information about whether Speaker Hinch was tested before his death, and they're not saying when his first day of symptoms started. The governor says state leaders are speaking with health officials to see if additional precautions need to be taken in the House and Senate offices.
Everyone should be concerned, whether it's in the workplace at the State House or workplace at Administrative Services or workplace at Fred's Flower Shop. Dick's passing is I think, a real, as tragic as it is, as heartbroken as we all are, it really is a warning sign that we are far from over this.
Health officials say, as with any other contact tracing they perform, nothing will be made public unless they are unable to identify close contacts on their own. Reporting in Concord, Siobhan Lopez, WMUR News 9.
Okay, and there you go on that video and that report. State officials prepare for Pfizer vaccine shipments next week. Moderna vaccine to follow. Let's take a listen to that video from WMUR News 9, Monica Hernandez.
This year, I got the most unique gift for the holidays. My wife gave me a Fleet Air Club membership for Christmas.
New Hampshire is gearing up for one of its largest logistical undertakings in recent history. It's expecting its first shipment of Pfizer's COVID-19 vaccine to arrive within days. 12,000 doses.
This is welcome news, I think, given that we're 9, going 10 months into the pandemic in New Hampshire, and this is one of the ways out.
Hospitals and long-term care facilities are first in line, followed by first responders. For everyone else, spring is the likely timeline. The state's top doctor assuring everyone the vaccine is safe.
We have every confidence in the process. We know that the FDA is not cutting corners in their review of these vaccines.
Crews are setting up 10 sites across the state that will operate daily, vaccinating thousands of Granite Staters. The state tapping a familiar face, former longtime state public safety official Perry Plummer, to coordinate logistics.
Perry's an absolute genius when it comes to logistical organization and simply getting stuff done.
But health officials stress, don't throw your mask out just yet. Until there's widespread vaccine distribution, social distancing and mask wearing are still key.
Once we have wider spread distribution of the vaccine is going to play an increasingly critical role in bringing this pandemic to an end.
To do that, Governor Chris Sununu says the state can use all the help it can get, from IT to transportation. To find out how you can volunteer, go to nhresponse.org. Monica Hernandez, WMUR, News 9.
Okay, and there you go on that video and that report. Manchester Mayor urges vigilance as COVID-19 cases climb. City hospitals struggling with staffing. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
The daily number of COVID-19 cases is growing in the city of Manchester.
We saw the high of 145 for a 3-day period. That was the highest. That was the peak for Manchester so far.
Right now, there are more than 1,200 active cases. Manchester's mayor says the city's health department is working around the clock on contact tracing and testing.
The city of Manchester provides 2 days of testing. Any resident in the city can give us a call. They need to register ahead of time. That phone number is 668-1547.
To help control the spread, the mayor is urging people to take precautions.
It's really important to note that this is the start of the surge, the second surge, and we have many weeks ahead of us. And it's really imperative that we all take this very, very seriously.
Doctors here at Catholic Medical Center say they've seen the number of COVID-19 patients they're caring for double since Thanksgiving, raising concerns about the days and months ahead.
We're seeing a surge this fall, which is greater than the surge in the springtime. We're actually struggling because we have many of our staff also being quarantined because of exposure in the community.
Dr. Michael Gilbert says if a hospital needs to transfer a COVID-19 patient to another hospital for any reason, they are allowed to do that, and it's something they're preparing for.
Every hospital in the state is working in a very coordinated fashion to help take care of patients. We're doing absolutely everything that we can to balance taking care of COVID patients as well as the urgent medical and surgical needs of non-COVID patients.
Reporting in Manchester, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. National Guard, Federal VA infection team assisting at New Hampshire Veterans Home in Tilton. COVID-19 outbreaks claimed 27 lives at the Veterans Home in Tilton. Let's take a listen to that video from WMUR News 9, Monica Hernandez.
This year, I got the most unique gift for the holidays. My wife gave me a Flavier clip. And the National Guard and the Federal Veterans Administration are helping to fill staffing shortages at the New Hampshire Veterans Home in Tilton. A deadly COVID-19 outbreak there has claimed 27 lives and infected 87 residents and 81 staff members. The VA has sent in 17 medical personnel, including members of the National Infection Control Team.
There is a national shortage of medical and clinical staff across this country. There's virtually nobody in this country as a medical provider, as a long-term care facility, who has extra staff just sitting around. Everybody is working double shifts right now.
Governor Chris Sununu says the federal VA infection control team will perform an outside review of the facility's processes and procedures.
Okay, and there you go on that video and that report. Last night was the first night of Hanukkah. Socially distanced menorah lighting kicks off Hanukkah at the State House. Celebration continues virtually. Let's take a listen to that video from WMUR News 9, Mike Cronin.
Most legacy backup solutions are outdated. An hour of downtime could cost you as much as a new car.
Tonight marks the beginning of Hanukkah, the Jewish 8-day festival of lights. The first candle of the menorah was lit this evening during a socially distanced ceremony at the State House. This year, large gatherings are just not possible, but candle lightings will continue, as well as online celebrations. The theme of this year's celebration is Count Your Blessings.
We're all somewhat affected in one way or another by this dreadful disease. But at the same time, it makes us appreciate maybe more so the blessings of the new health and the friendship and the love we do have, starting with our own family. So that, the truth is it does refocus our thinking, our way of life.
For more information on local celebrations, you can visit shabbatofnh.com, and we're told that an EMT actually lit the first candle tonight in honor of our frontline workers out there. That's really awesome. Lovely, yeah. And happy Hanukkah to everyone celebrating.
Okay, and there you go on that video and that report. And today, the 2020 Spirit of Giving food drive kicks off. Donation December 11th through the 13th. Let's take a listen to that video from WMUR News 9, Charisse Leclerc.
This year, I got the most unique gift for the holidays. My wife gave me a Flavia clip.
Well, the need to help people in New Hampshire is very real every year, but those at the New Hampshire Food Bank say, as with a lot of aspects of our lives right now, the need is greater than ever before this year. Now, a lot of people will be helped by the food on the shelves here at the New Hampshire Food Bank, and you can help make sure people in your community who struggle to find their next meal don't have that worry this season. We're teaming up with the Food Bank, Hannaford, Shaw's, and Walmart for our annual Spirit of Giving food drive. At stores statewide, you can give Hannaford $5 or $10 donation cards right as you check out. At Shaw's locations, you can add a financial contribution to your total, and Walmart has pre-packaged bags of food you can purchase and donate. The Food Bank estimates that 1 in 7 people in New Hampshire does not know when or where their next meal is coming from, and due to COVID-19, 21 to 23% of children in the state are living in food insecure environments.
I mean, this time of year, people are generous anyways. But obviously 2020 has just added a whole different layer to that. Like you said, people struggling, depending on what kind of business you're in, you might be out of work, been out of work for a while. Your food banks are definitely getting strained, and this will definitely help fill up those food pantries.
Last year, the New Hampshire Food Bank distributed more than 14 million pounds of food. That's almost 13 million meals, and this year you can help do that again. In Manchester, I'm Charisse Leclerc, WMUR News 9.
Okay, and there you go on that video and that report. And thank you for joining us for this morning edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.